Hello, health literacy friends. I think we are at a point in our history where we can no longer talk about health literacy without talking about health equity. And in this IHA Lightning Talk, I want to share a work of Wisconsin literacy and Wisconsin health literacy and our literacy, health equity, and our response to COVID-19. My name is Michelle Erickson. I'm the Executive Director of Wisconsin Literacy, Inc., and our division, Wisconsin Health Literacy. I want to start by talking about where we were in March of 2020 when we realized COVID was going to really impact our work and that of our 70 local agencies that we support. Wisconsin Literacy's statewide organization that builds the capacity of 70 local member agencies to teach adults reading and writing in English language and to improve their job readiness skills and to help them with English language. And we quickly learned in the middle of March that our students were being incredibly impacted by COVID. Many of them were considered essential workers. Others were losing their jobs without access to unemployment benefits. Things were happening at a rate where they were not able to take everything in and understand this impact, particularly those with language barriers and those with limited technology skills. So we kind of went to work right away. The governor put out this safer at home order, this emergency order, and within about 24 hours, we were able to turn it into a plain language document here on the right, where we were able to use a question format answer and quickly distill a lot of whereas legal government language into some questions and answers that our students really and a lot of other people could understand and know what was available to them, where they could and couldn't go during the safer at home order. We are also realizing that there was a lot of confusion out in our community about masks and about hand washing. How do you social distance? That's a new term. And what does that mean when you live in close quarters with many people or you don't have access to fresh water to wash your hands whenever you need to? And these masks, do they really mean, or do they really help prevent COVID from spreading? There was a lot of misinformation and misunderstanding. Very early on, we came out with a Let's Talk About Viruses just fact sheet that we were able to share in many different languages and throughout the community around some just 4 to 5 basic things that we felt we wanted people to know about COVID and what they should and shouldn't do during this time. We also heard quickly that kids were home and they were home to stay for a while. And again, some of our parents being essential workers, what did this mean for them when they couldn't be around their children to help with school? What did it mean if they didn't have any experience with a Chromebook or an iPad that their children were now required to learn on? And who was going to be able to help them do that, particularly if they didn't have experience themselves with that technology. We learned too that our celebration of literacy event that we do every other year, we thought we would cancel, and what ended up happening is that we decided to pivot and move ahead with a virtual fundraising event. And this was a time in April that a lot of agencies hadn't tried this yet. And we ended up actually pulling off an event that had a lot of engagement throughout the state. This is our keynote speaker who has been challenged by dyslexia his whole life and was able to share his story with a statewide audience. And our person behind the controls that allowed us to actually use a Zoom and a YouTube platform together to create this event. And we knew that after we did this, and it was a success, that we had to share this with our other agencies to keep them moving and keep them meeting with their boards. So we were able to have a lot of professional development that we offered. This is one of our member agency directors in a professional development webinar sharing how her Scrabble Bee tournament fundraiser went for her. Wisconsin Literacy does a lot of professional development, and during this time, we were working with our agencies on all different kinds of fronts, but we were particularly aware of their need to have the technology access to their students, internet access for their students, and professional development and how to use that and keep their learners engaged. So we did a lot of things around learning Zoom, learning WebEx, learning GoToMeeting, so that they could keep engaged. And we also ended up buying Zoom accounts, buying internet hotspots, so that students that didn't have access could find access during this time. We also worked on voting and the census, and some of this happened during the time when we were just before COVID, but as COVID hit in the spring, we knew the importance of keeping this information out in front of our member agencies and their learners and helping them understand how to engage students. We know that voting and the census were going to really impact their lives, and communicating that to them, the importance of that and the importance of their engagement was really important. So we had people from the League of Women Voters and the U.S. Census Bureau come and provide an online professional development opportunity for our members to keep this front and center for many of our programs. We also have our health literacy division that had a lot of pivots as well. So we began with pivoting on healthcare in terms of its delivery, and understanding from our healthcare partners that COVID had kind of catapulted telehealth visits into a whole new level, and that many people, particularly in our network, that hadn't had experience with online visits before, this was something new. So we worked to provide permission for telehealth visits and scripts for making patient appointments for the providers. We worked with AHRQ and other telehealth form associations to get plain language messaging out about really what telehealth means for the patient. Our division of health literacy also works a lot in the community, and we have a particular project we've just finished up called Let's Talk About Opioids. And we knew we couldn't deliver it in the correctional settings given the impact of COVID and the fact that many justice-involved individuals were required to be isolated more and doing work individually. So we quickly turned in what we would normally be doing in in-person workshops into resources that they could use on their own, like a student activity guide and workbook. We created a Moodle module and a Train the Trainer resource, as well as a full-length video on the different risk involved in opioid. A lot of these resources now will be on what we hope the intranet that is available for Department of Corrections, so that justice-involved individuals have the opportunity to continue their learning on an intranet. And we're looking forward to having those materials downloaded for further use. We worked on 6 different video topics to talk about the risk of opioids and how justice-involved individuals are very much at risk, particularly on re-entry, for overdose. So we found that these videos have been very, very well received, and are looking forward to having them be in learning environments for people in corrections. Our health literacy division was also, over a year ago, we were invited to be a part of a social enterprise incubator program where we were looking to develop health equity services for healthcare providers. And we had developed some workshops around building inclusive communities. We were taking a different approach to this, and that we were trying to create a service where healthcare would build their own community intelligence, just much like we know of emotional intelligence, that healthcare would work with the community, and there would be kind of a co-facilitation with healthcare providers in the same room with the community to kind of work on building this trust and building this understanding between the communities they serve and the healthcare providers themselves. And in doing this, we've had a couple pilots start, but were delayed by COVID, and really looking at how we can help, again, begin to rebuild the trust between healthcare and the communities they serve in a way that is not often done, in which we would be doing it together with the community. So a lot of our work that we try to focus on, we believe in the value of co-creation, where the community is actually an equal partner in helping us develop the messaging, the resources, and what is going to be valuable to the community itself. This is an opportunity for us to learn a lot more about, social determinants of health that impact people as they seek out healthcare, and helping healthcare understand those as well in a way that is meaningful for everybody involved. So by the end of June, we were pretty tired. We'd been doing a lot of work in a lot of different areas. And when I saw this meme, I kind of had to laugh, because I wasn't sure what was around the corner. And like many, many organizations, we too were impacted by COVID in some, in funding, and loss of funding, in just changing up the way we do things, everybody working from home, kind of what was coming next. In July, we started to see a resurgence of COVID. So, but yet we knew that the community we serve, there was still immense need out there. And there were a lot of people with just far greater challenges, and that we knew we had to kind of continue to figure out. So July has come and gone, and we're still here working and providing services. But I would say in all this, it is really important to take a breath and to realize how important your work is, and how every day it can really make a difference for people that are struggling to get through the challenges that we are in right now. So I remember at the IHA wrap-up on Friday of the last day that we talked a lot about this community understanding the kind of the why of health literacy and the what of health literacy, but the how of health literacy was somewhat more of a challenge in many ways. And how do you just kind of jump in and start with that? We really believe that that there are some things that are important when you're thinking about the how. And one of the things we've worked on is to really be good partners with the communities that we're supporting, particularly now with communities of color, where coronavirus is having such a larger impact on individuals and their families. And so thinking about how we follow the community's lead and how we can offer support. And also to consider if our resources and communication tools and expertise is really appropriate and can be of help, so that we are not in the community prescribing what we think is a skill set or a resource that is going to be impactful, but actually co-creating that with the community. A couple other things that I think you can do now is create safe spaces for group conversations. One of the things I mentioned earlier we did right away was provide professional development around virtual platforms where people could have conversations. We started Thursday morning coffee chats with our members so that agency directors could have a place to go to hear from other directors about what was a challenge, what was working well, what wasn't working well in terms of keeping their services going and keeping in touch with their students. We are actually, with some of the grant funding, buying Zoom accounts for our member agencies so they can continue to have board meetings, and they continue having classes on Zoom We've done hotspots. We're just starting to buy hotspots for internet access for people in our more rural areas that don't have access to that. So we're considering a lot of new and old school delivery methods and resources for learning materials that we normally would be doing in person, and thinking about new ways to deliver those services. Another thing that I think is at the heart of addressing COVID and health literacy and health equity, of course, is plain language. I know we talked a lot about this too at the IHA conference, and the importance now of communicating in plain language. We are providing some very introductory webinars now to introductory to plain language, but we also have a kind of a deeper dive and a more advanced session, and then some customized training that is available, and we're promoting through our website and some of the partners that we work with. I particularly think about schools right now who have a lot of important information to communicate to parents, and hoping that they're able to do that in plain language as this kind of whole new world of virtual school continues on to throughout the end of 2020. And again, thinking about what your health department, your city or government, state government is putting out around COVID right now. A lot of emergency orders are coming out, and this is an example of an eviction and foreclosure order our governor put out. We were able to distill it quite quickly from 2.5 pages to a 1-page, again, question answer format in plain language. That really helped a lot of our students, our renters, and were very concerned as they came to the end of the month early on in COVID, and even now, what this meant for them, what were their rights under emergency orders as it relates to evictions and foreclosures. And I know that many of us already know the why, but we are in a really critical time in our history, and I think health literate information now is more important than ever into fighting this pandemic, to communicating around social and racial justice, and to helping people through a really impactful economic downturn that we're feeling in many different ways. So I think building trusting relationships between healthcare and between Black and Brown and Indigenous people of color, communities of color, is really important right now. It's a critical piece, that trust building of how we move forward. And we have this unique window of opportunity that unfortunately has taken us hundreds of years to get to. And we're really hopeful that this time there is meaningful change and meaningful differences. And that only happens when we start to build these relationships, particularly in healthcare, but it crosses so many different specters, just different areas of our lives that it's really important. So taking this opportunity to stay engaged, to keep the social racial justice movement alive, and to begin to think about how people move through this pandemic. I think we would all agree that COVID has forever changed how we do business. Technology skills, plain language, and trusting relationships are 3 things immediately that come to mind as essential to be able to participate in our world. That is looking very different now and may continue to look very different for a long time. So I thank you for allowing me to share some of the work that Wisconsin Literacy and Wisconsin Health Literacy has been focused on during this time. Please reach out to me with any questions or further follow-up. Again, thank you for this time. Stay well.